Welcome to Priming for Beginners with the Exercise Therapist. Today we're going to look at priming, getting the body ready, particularly, more specifically, the pelvis and the hamstrings and the lower extremities, ready to engage in healthy biomechanics whilst cycling. The most common injuries in cycling: patellofemoral syndrome, quadriceps syndrome, a lot of hip friction issues. The most important thing with cycling is that you get a really good fit, bike fit. So if you plan on starting up cycling, we've got great places in Perth you can go to. Damien Oldmeadow at Star Physio is one in particular. It does very good clean bike fits with biomechanical acknowledgements specific for your body's needs. Okay, that is the first and most primary cause of injury, chronic injuries, reoccurring overuse injuries with cyclists. The second is the pelvis. So we want to look at releasing the pelvis. When you're in the cycling position, back pain can result, and shoulder tension and tightness and tingling through the hands and forearms can occur when there's not enough flexibility through the hamstrings or the pelvis. And you get this posterior sitting or tailbone tuck under, okay, which causes, when your hands are out here, which causes this hinging point, all right, along various points of the spine. Sometimes it's here, depends on the length of your trunk and where your power sources are, and the cycle of the muscles that you use in a cycling, whilst you're cycling, is all encompassing for the lower extremity. So if you have a weakness in one particular area, particularly the glutes or the quads, VMO, anterior pelvic stabilizers, then you're going to be more predisposed to overuse injuries. So we'll look at that in functional strength for beginners for cyclists. So look out for that video. But today we're going to look at trying to improve this angle from that to here, so that there's a lot more relaxed extension out to the handlebars of the trunk. Then we're going to fire up these anterior stabilizers to support that, release the hip flexors, because if the hip flexors are tight, you're not going to be able to get those knees up and relaxed without tracking laterally. Okay? Often with tight hip flexors, even with a good fit, you have the right angles and the right distance between your cleats and the seat height, but if your hip flexors are tight and you come into knee flexion, if they're really tight, you're going to roll out externally through the hips and pelvis. Okay, so let's start with some 4-point kneeling, and we're just going to basically do our cat back. So we're going to arch that spine as low as we can get it, and then curl it up. We're doing this just to get a good idea and a good feel for what a neutral position is before we engage in any of the other priming activities. Swinging and lowering. Each time get a little bit higher. So working through those shoulder blades as well, pulling up through the belly button, and then dropping out and dropping the scapula as low as we can. Okay? Activating and releasing those hamstrings a little, and just loosening the pelvis. And up. Okay? Once you've done that 4 to 5 times, quite consciously improving the intensity of the angle each time, we're going to come over onto our back. We're going to start with this single leg compression. So we're going to interlace the fingers, nice chin tuck, gentle. Again, priming comes after connection and observation. So very much focused around our breath and the awareness of where our body's tight, what's happening with our ankles as we compress. Quite often, with tight hip flexors, those feet can come in, or they're going to go out if you're pulling too aggressively across the body. So you want the second toe in line with the mid-patella, in line with the hip, mid-clavicle point. Okay, big breath in and out. And we can increase the intensity a little by lifting that long leg off the ground. What we're trying to do is activate the stabilizing muscles at the back of the body, the rhomboids, rotate a calf, get extension through the long leg, easy compression through the leg that we have in flexion. Now hold that for about 10 to 15 breaths. And then change sides, observing how long it takes that side to release and if there's any deviation or rotation. Also, if there's any challenge wanting to come up and off, often in response to tight hip flexors. So use that breath. The distance between the hip and the bottom rib, long and even on both sides. Kick the long leg heel out. Beautiful. Then we're going to come into the glutes. We're going to work that pelvic tilt from a different angle now. You might want to just give those hip flexors a bit of rub. That's a lovely trigger for the hip flexors. And we're just going to do our tilts here. Again, exactly the same as when we were doing 4-point kneeling, except now we're really wanting to focus on those glutes, working with the hamstrings to move the lower vertebrae and help them rotate back onto themselves, lifting the pelvis up towards the sky or ceiling. You can get tactile here, feel the hip flexors being dominant, switch them off, switch the glutes on, and hamstrings, pushing through the heels. See how the knees respond to that tension. Where is the tension coming from? Is there a pull on the patella on one knee? Okay, they're the things that you've got to pay attention to. So when it comes to your foam rolling, you know where to focus, which is what we're going to come into now. Always do psoas again, always with psoas. Pregnancy, trying to get pregnant, any adhesions or surgery to the abdominal region, don't bother. The single leg compression should suffice, but this is just a really effective additional trigger. Reaching that leg out and the arm forward, just loading that pressure, finding the trigger point, loading that pressure by gently pushing the hip down, working the breath. Again, psoas is heavily linked to the diaphragm. Very, very, very similar point of joint where they join and meet. So we're trying to make sure that that's a positive relationship, not a negative one. Okay. So after we've done psoas on both sides, we come into the foam roller. Now we're ready to release. The reason why we do psoas first always is because if you're tight through psoas and you're pulling up and under here, changes the angle of the pelvis. Okay, so you're going to be working different points of that ITB. If you can release this first, you're going to get a better angle of release from the iliotibial band. So we'll start with ITB, running all the way down to the outside of the knee, working the trigger points, rolling forward onto the quads, working through strongly on both sides. And once you've released that on both sides, you're going to come up back into the 4-point kneeling with both hands on the ground, directly under the shoulders, not out in front of the shoulders here, not behind them, directly under them, knees directly under the hips. And then from here, breathe out and roll. Now this is a great priming activity because it activates and stimulates the anterior stabilizers of the pelvis, but also releases tibialis anterior and the shin, which is really important for that ankle movement. dorsiflexion when you're cycling. If you can look after all the joint angles, starting from the ankle, knee, hip, spine, then you're going to be really putting yourself in the safest position to get the most pleasure and power out of your cycling, but also to reduce your injuries. Enjoy.